Caution! Did you know that some pills you may already be taking every single day could actually be quietly harming your memory? Imagine going to your doctor for help with sleep, pain, or allergies, and instead, the very medication prescribed might increase your risk of dementia. Millions of older adults rely on daily medicines for common issues, like anxiety, stomach problems, or even simple seasonal allergies. But recent studies have revealed something shocking. Certain medications, especially when used long-term, can interfere with brain function, slow thinking, and even raise the likelihood of developing dementia. This video is not meant to scare you. It's meant to empower you with knowledge. Because once you know which pills are risky, you can have an informed conversation with your doctor and ask about safer alternatives. So today, we're going to uncover 4 of the most common types of medications linked to memory loss and dementia risk. You might even recognize some of them in your own medicine cabinet. But don't worry, I'll also explain what you can do instead and how to protect your brain health for the years to come. Stay with me until the end, because the last group of medications I'll mention is something almost every senior has taken at some point, yet most people never suspect it could harm their memory. Now, let's begin. Why medications can affect memory. Before we dive into the specific pills, it's important to understand why certain medications interfere with memory and brain function. Our brain is like a finely tuned electrical network. To function well, it relies on chemical messengers called neurotransmitters. These include acetylcholine, dopamine, serotonin, and others. They help with attention, learning, problem-solving, and forming memories. One of the most important for memory is acetylcholine. Think of it as your brain's memory messenger. It plays a key role in how brain cells talk to each other and how memories are stored and recalled. Here's the problem. Many common medications block or reduce acetylcholine activity. These are called anticholinergic drugs. When acetylcholine is blocked, people may feel groggy, confused, forgetful, or slower in thinking. Over short periods, this might just feel like brain fog. But when taken for months or years, research has shown that these effects can accumulate, leading to a higher risk of cognitive decline and dementia. Other medications don't directly block acetylcholine, but they may alter brain chemistry in other ways. For example, sedatives slow down brain activity, which can dull memory and focus. Now that you know the mechanism, let's look at the 4 types of medications you must be cautious about. 1. Sleep medications and anxiety drugs, benzodiazepines. Let's start with one of the most prescribed drug groups in older adults, benzodiazepines. These include familiar names like diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, temazepam, Restoril. They are often given for anxiety, insomnia, and even muscle spasms. Why they're risky? Benzodiazepines work by enhancing the effect of GABA, a neurotransmitter that slows down brain activity. This is why they make you feel calm, sleepy, or relaxed. But long-term use has serious consequences. Seniors using these drugs regularly have a 30 to 50% higher risk of developing dementia. They impair the formation of new memories, meaning while you may function, your brain is failing to store information properly. They also increase the risk of falls, confusion, and dependence. Real-life example. Imagine an elderly woman who has trouble sleeping. Her doctor prescribes a sleeping pill like temazepam. At first, it works. But over time, she needs higher doses and she begins to forget conversations, misplace things, and struggle with daily activities. The family assumes it's just aging, but the pill itself may be contributing to memory loss. Safer alternatives. Cognitive behavioral therapy for insomnia, CBTI. Natural sleep aids like melatonin with doctor's approval. Relaxation techniques before bedtime. Short-term use only, and at the lowest dose possible. 2. Anticholinergic drugs for allergies, overactive bladder, and more. This is the biggest group of risky medications linked to dementia. They include drugs used for allergies, depression, stomach issues, and urinary problems. Common examples. Diphenhydramine Benadryl for allergies or sleep. Oxybutynin Ditropan for overactive bladder. Tricyclic antidepressants like amitriptyline. Certain antispasmodics for stomach cramps. Why they're risky. These drugs block acetylcholine, the key memory chemical we mentioned earlier. When used long-term, the effects can be devastating. Research has shown that seniors who use strong anticholinergic drugs daily for 3 years or more had a 54% higher risk of dementia compared to those who didn't. Symptoms to watch for: dry mouth, constipation, blurred vision, confusion and forgetfulness, difficulty concentrating. Safer alternatives. For allergies, newer non-sedating antihistamines like loratadine, Claritin, or fexofenadine, Allegra. For depression, SSRIs instead of tricyclic antidepressants. For overactive bladder, bladder training, pelvic floor therapy, or newer meds with fewer brain effects. 3. Certain pain medications, opioids, and muscle relaxants. Next, let's talk about pain medications. Opioids like morphine, oxycodone, hydrocodone, and codeine are powerful pain relievers. They're essential for short-term severe pain, like after surgery. But when used long-term for chronic pain, they can slow thinking, reduce attention, and affect short-term memory. Muscle relaxants, such as cyclobenzaprine, also have anticholinergic effects, which worsen memory problems. The hidden danger. Many seniors use these drugs not only for chronic pain, but also for minor issues like backaches or muscle stiffness. Over time, the effects on the brain accumulate. Research suggests long-term opioid use is associated with a higher chance of developing cognitive decline. Safer alternatives. Physical therapy. Gentle exercise like swimming or yoga. Heat therapy, massage, or acupuncture. Non-opioid medications such as acetaminophen or topical pain relievers. 4. Stomach acid medications, proton pump inhibitors, PPIs. Here's the group most people don't expect. Proton pump inhibitors, PPIs. These include omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid. They're often prescribed for acid reflux, GERD, or stomach ulcers. Why they're risky. PPIs are very effective, but studies suggest that long-term use may increase dementia risk by 40 to 50%. The reason? They may reduce vitamin B12 absorption, which is crucial for brain health, and alter gut bacteria, which affects brain function through the gut-brain connection. Safer alternatives. Lifestyle changes. Avoiding late-night meals, reducing spicy or fatty foods, losing excess weight. Using PPIs for short durations only. Asking the doctor about switching to H2 blockers, like famotidine, which may have fewer risks. Protecting your brain while taking necessary medications. It's important to remember, not everyone can stop these medications immediately. For many, they are necessary. But here's what you can do. 1. Never stop suddenly. Always consult your doctor. 2. Review your medications regularly. Ask your doctor or pharmacist, is this medicine still necessary? Are there safer alternatives? 3. Use the lowest effective dose for the shortest time possible. 4. Boost brain health naturally with exercise, a healthy diet, mental stimulation, and good sleep habits. Let's recap. 4 common categories of medications have been linked to increased dementia risk. 1. Benzodiazepines for sleep and anxiety. 2. Anticholinergic drugs for allergies, bladder issues, and depression. 3. Opioids and muscle relaxants for pain. 4. Proton pump inhibitors for acid reflux. Remember, knowledge is power. Many seniors assume memory loss is just part of aging, but sometimes it's not age, it's the pills. So, if you or someone you love is taking any of these, don't panic. Instead, take the first step. Have an honest conversation with your doctor. Ask, do I really need this medication? Is there a safer option? Your brain is priceless. Protect it. Don't let unnecessary medications steal your memories. And if you found this video helpful, make sure to share it with friends and family because you never know who might need this information today. Stay healthy, stay informed, and always take charge of your own health journey.